Welcome to the Peak Mental Performance Podcast with Joe Schillero, optimizing your mental health and athletic performance one episode at a time.
2, 1. And all right, welcome everybody to another episode of Peak Mental Performance. I have with me today Jesse Cook. He's a research specialist in the Department of Psychiatry at the University of Wisconsin-Madison. He earned his bachelor's degree in psychology and worked as a research assistant in Dr. Richard Butzen's lab, which focused on sleep. He then joined Dr. Plant's laboratory at his current place of work in June of 2013 as a research specialist with the Department of Psychiatry. He has focused on an interest in the relationship that's shared between sleep and mood disorders and the neurophysiologic kind of effects that has with sleep disordered populations. And he's also currently working on his doctorate in clinical psychology. So kind of a little bit of a mouthful, but I think his experience lends itself really well to the discussions we are touching on. So thank you, Jesse, for doing this today.
Oh, my pleasure, Joe. It truly is a pleasure. It truly is a pleasure to be on here. I've had the opportunity to expose myself to a couple of your episodes so far, and they've just been fantastic in disseminating important information for general health and well-being. So hopefully I can carry that torch a little bit farther and provide some insight into the proper techniques and importance of sleep.
Yeah, absolutely. Thank you. Thank you for taking the opportunity to do that. You know, in the last, like I mentioned when I kind of typed up the preview for this episode, in last week's episode with Dr. Jordan Tischler, we were talking about applications for medical cannabis, and one of the topics that kept popping up was the topic of sleep, and inevitably I thought that's probably the next topic for us to dive a little deeper into. So for our population of, which is mainly comprised of coaches, athletes, some recreational athletes. You know, I think most people have at some point read some article, whether it's just kind of on a mainstream news site or, you know, Men's Health or something about why sleep's important. And I think for a lot of times, those articles, while good, they're just kind of touch very much on the surface, and kind of a lot of times I think it feels for athletes like, yeah, that's something like, it just sounds like something my parents told me when I was a kid, you know, get enough sleep. So, but there's actually, in the things that you're studying, a really in-depth relationship between sleep and then this context of mental health, which we are focusing on. So could you, I know there's a lot of directions and a lot of depth we could go with this topic. Could you speak a little bit of why you started researching this topic and some of the connections you've been seeing between how good of sleep people get and then their mental health and mood?
Sure, absolutely. And so kind of taking a step back to my history a little bit, back as an undergraduate, I had the opportunity to take sleep and sleep disorders as a course under the late Dr. Richard Butzen. And I just became kind of enamored and truly fascinated by how much sleep impacted everything in life. I wasn't aware of the vast nature of sleep as a medical field. And that's what piqued my interest initially and led me to join his laboratory. And, you know, you harped on it a little bit. The casual individual in our society, just normal individual, tends to have this preconceived notion due to Time Magazine, the Huffington Post, whatever it may be, that 8 hours sleep time is what you need to aim for. And in a lot of ways, that's a bit of an arbitrary designation. Sure, duration is an important concept, and too little and too much, which is something that I focus on, and we can talk about that here in a bit, can be debilitating and lead you to risk factors or an increased risk for various disorders, whether they're psychological or physical, down the road. And duration, again, is important. We don't want to shortchange ourselves. You know, something, if you're looking for numbers per se, in between that 6.5 to 9 hours is optimal. Within that, though, you kind of want to play your own scientist, if you will, And you want to evaluate what is an appropriate number for yourself. For me, that's become about 7.5 hours, 7 hours and 15 minutes or so. And I find that I perform optimally at those levels. For me, I think within a sleep hygiene aspect, and we can talk about what that entails more down the road, scheduling consistency is most important. You want to make sure that your body's entrained to respond to the window of sleep that you're providing it most optimally. So having a routine set bedtime and a consistent wake time in the morning may be more important than the actual number you're trying to target, if you will. And the number you're actually trying to target may actually negatively impact your sleep quality as you're fixating on a certain aspect of sleep rather than letting sleep happen naturally and kind of tranquilly. And from that, you can interfere with sleep quality. And when we talk about sleep quality, you can have waking up quality, you can have subjective and objective sleep quality. Subjective sleep quality is, us going to sleep, waking up the next morning, and rating how we feel based on our sleep. And that's important. The humanistic experience is always important. But then within that, there's layers of objective sleep quality. And we can measure objective sleep quality through actigraphic devices, which use accelerometer-based mechanisms, similar to what the wearable devices use with the Jawbones and the Fitbits and those types of things. And the WOMP, I don't know, the athletic population tends to be pretty familiar with the WOMP device. And even furthermore down the road, we can actually look at the physiological responses internally and the electrophysiology of the brain to evaluate different stages of sleep. And not all sleep is created equal. And most people tend to be familiar with this term REM. Everyone's fascinated when I sit down on an airplane and tell people that I'm involved in sleep. The first thing that comes out of their mouth is that 8-hour number, and it usually is followed up immediately by the words REM cycle, regardless of whether they actually know what it means or not. And REM cycle really means just a progression through this kind of architectural staircase of stages. And we talk about the staircase as something called the non-REM stages followed by REM. And the non-REM stages are N1, N2, and N3 followed by REM sleep. And that's a pretty prototypical cycle, and that fluctuates throughout the night. In a clinical sense, the most important aspect of sleep, if you will, is something called slow wave sleep, which is N3 sleep. And that's what we consider the most restorative aspect of sleep and can be influenced by homeostatic need more so than other stages. And our laboratory tends to focus on that as we tend to be clinically more focused. And so prioritizing that, which occurs in the earlier hours of night and can be negatively influenced by alcohol intake or pharmacological interventions, things of that nature, is of utmost importance rather than fixating on duration and other REM-specific components of sleep.
Yeah, it's definitely really interesting, how multidimensional it is. And I think for the longest time, people just think of those couple, those two things, like 8 hours and are you getting REM sleep? And so I think that's really interesting. For people who say for that, for those levels of sleep that are helping people get the most sleep quality and restfulness for the next day, when you see, I know obviously a lot of your focus is on the psychiatric side of things. When people are consistently over time getting poor sleep quality and some of the things you mentioned, what are some symptoms and things that you see come up on the psychological side when that's happening, when their sleep quality is poor over an extended period of time?
Sure. So you can actually see many different manifestations of psychological interference and abnormality due to poor sleep quality. You can see increased levels of depression, and at the same time, you can see increased levels of mania. We tend to think of poor sleep quality from a short sleep duration standpoint as a prodromal symptom for individuals about to experience a manic episode. We can also see individuals consistently getting sleep restriction to 3, 4, 5 hours of sleep a night, slip into very severe levels of depression. And one of the things that we see quite a bit is this relationship between chronotype. And what I mean by chronotype is the individual's kind of either programmed or naturalistic propensity for being an evening individual or a morning individual, and the relationship with that between proper mental health and very severe situations like suicidality, where a lot of individuals who have a propensity for evening time or have lack of a desire, if you will, to sleep during our normal periods of time tend to have higher relations with suicidality, obesity, cancer risk, things like that. Whereas individuals who tend to align themselves more with our kind of evolutionary programming of sleeping when it's dark outside and waking up when it's light outside and getting that normal period of sleep, tend to find themselves in a much more comfortable state of existence and proper health and well-being. So that was kind of a bit of a tangent there, but we can see a wide array of symptomology that's associated with that type of interference of sleep. And what's fascinating is a lot of people tend to be very familiar with insomnia, as it's very prevalent in our society, especially with the increase in electrical stimuli in our day-to-day lives. You know, everyone has an iPad, everyone has computers, cell phones, whatever it may be, and they tend to interact with our day-to-day throughout the entirety from wake until sleep, and even during sleep at some points. But one thing that people aren't as familiar with is there are these umbrellas of disorders aligning or associated with hypersomnolence, where individuals are actually sleeping 11 to 13 hours a night, never feeling refreshed from their sleep, and actually experiencing severe levels of depression or having high rates of comorbidities with other psychological disorders. And so it's important not to just consider that poor sleep is only associated with less sleep duration or difficulty falling asleep or maintaining sleep, but it can actually also be associated with the other end of the spectrum of getting too much sleep or just the mechanisms of sleep not appropriately responding to what needs to happen. And, you know, as we kind of touched about earlier, most individuals in our society don't have a robust understanding of sleep, and I think that's a societal issue fundamentally. Before I became a researcher, before I joined Dr. Bootson's laboratory, you know, I thought of sleep as this concept where you just went into a bedroom, you closed the door, and 8 hours later you came out and you felt refreshed. And the reality is, sleep's a much more complex ordeal than that. And proper sleep, people tend to ask me, what can I do to sleep better, right? And that's a very complicated question, but proper sleep tends to start from the moment you wake up to the moment you go to bed. It's kind of like a training athlete. What you put in your body at the beginning of the day, how much light you expose yourself to throughout the day, how much light are you exposing yourself to a few hours before bed, how many hours before bed have you exercised recently. All of these things can interfere with your sleep quality, and even within that, you may actually be asleep, but you may not be touching the deepest stages of sleep because of the things that you've done to your body earlier in the day. And I think it'd be important or integral for society to start teaching youth and our adolescents more appropriate techniques for sleep, considering how much sleep interacts with just about everything in our lives.
Yeah, absolutely. And I think to your points about some of the symptoms that come up when people are getting poor sleep quality and the general lack of understanding, that's one of the purposes that I pretty much touch on in every episode of this podcast is getting people to think more multidimensionally about their mental health, because I think one of the problems, and there's a lot of practitioners and a lot of clinicians and a lot of counselors and people doing an excellent job in their fields with mental health in this country. But I think one of the issues that a lot of people struggle with is that they typically receive very one-dimensional care or answers when it comes to their mental health. And, for somebody who has symptoms of, especially for very syndrome-based, symptomatically evaluated mental health conditions like depression or anxiety, sleep is probably playing a big role in, I would say probably most people's mental health, whether it's kind of the, chicken before the egg, whether their,
Absolutely.
anxiety leads them to get poor sleep, which then, downward spirals into depression and then, keeps going. But I think that's one of the reasons I wanted to talk about this topic too, is that even if somebody goes to, their family doctor and they talk to them about some of their depression symptoms, and whether they receive a medication or they go see a counselor, I think really addressing things like this sleep aspect is such a huge tool that if you don't address it, you're just missing this huge cog in the approach, because of the things you just mentioned.
Absolutely. That was very well said. And I, sleep and mental health are two fascinating realms of our medical field. And because they both seem to be stigmatized in some aspect about receiving proper health or proper treatment, um, it almost seems like our society appropriates these two issues, if you have any sort of issue, as a weakness. And there's an uncomfortability about discussing this within our normal social realms. And I'm a firm believer that going to see a counselor is a very important aspect of life, even if you consider yourself the most healthy individual out there. And I think being aware of ways that you can improve your sleep quality, even if you consider yourself the most healthy individual out there, is an important aspect of life. But I always find, and you can see it in facial cues or whatever it may be, that as soon as people start talking about these subject matters, they get a little squeamish, as if like there's something fundamentally wrong with them because they seem to be struggling with the ability of handling day-to-day stress, and that's interfering with their ability to fall asleep, or they lay in bed ruminating about all the work they have to do. And as you said, does that exacerbate any sort of anxietal risk they already had or was predisposed to? And eventually all of that snowballs into this thresholding breaking point where eventually it becomes a really big problem, and we have to turn to more invasive pharmacological interventions rather than addressing the issues at a much more basic level and behavioral modification, and not crossing that very complicated bridge down the road where the problems are much more difficult to tackle. And again, I think this is a fundamental core problem with our society, and we could do a lot better job in our educational system, but that's not what this discussion's about, and that
Right.
we could spend months on that one.
Yeah. Yeah, absolutely. I completely agree. And I think to your point too, particularly in the athletic populations, whether it's collegiate athletics or pro athletes, or even, many of our listeners are athletes in strength sports, which are more kind of personal individual sports. I think there's a lot of dogma that just gets repeated a lot of times of like kind of glorifying like glorifying this idea of like get up at 4 a.m., work until 2 a.m. And it kind of makes people feel like if you're not doing that, or am I not working hard enough? And I think that's obviously very counterproductive to the individuality of people, to chronotypes like you mentioned, that for some people, yeah, they could get up at 5 a.m. and go train. Other people, that's not going to be an ideal time for them to go perform whatever they need to do. And so I think there's, that's another goal of hopefully getting more of this information out there for people, is people to understand of like, just because stuff gets repeated over and over again doesn't mean you have to use it. There's a lot of just complexity that I think doesn't get justice in the, whether it's the memes or the quotes or whatever gets passed around, particularly in the athletic population.
Absolutely. And it's coincidentally you bring that up. I'm currently making a transition in my life to more endurance sports training. And I found myself, as I've been preparing for these triathlons, falling into some similar traps that I've seen other athletes that I've talked to and worked with fall into, where the first thing that you tend to deprioritize is sleep in our society. And you just find yourself reaching for that extra cup of coffee, or cognitively telling yourself that, I'm okay at 6.5 hours, even though you know that you perform best at 7.5 hours. And we know that on an acute level, night to night, day to day, a couple hours here or there, one bad night of sleep's not going to hurt you. But to develop into this cognitive pattern that where you're reinforcing yourself, forcing yourself that I'm performing fairly well on this amount of sleep, that's 6 hours or 5.5, like maybe this is all I really need. We're very trainable as humans, and then that's a slippery slope there. And so I think it's really important, especially for all athletes, to I mean, even LeBron James says that the most important aspect of his training is his sleep. And there's a researcher, Sherry Ma, who works with the Golden State Warriors specifically, and some other teams, and she's had a lot of profound success with Andre Iguodala extending his sleep 2 hours. And it's directly impacted his ability to make free throws. These very direct implications have come just from simple things like that. And we all look at ourselves and we're like, how am I going to be able to extend sleep? Where am I going to find this? And it just becomes from priorities. And if you really do value your ability to perform and your health longitudinally, then it's something that needs to be prioritized in life.
Oh, absolutely. And yeah, the more that I'm trying to get in deeper into this, and my hope is that we'll be able to continue to do more and more episodes diving into different areas of sleep. But the the more I've been researching, you hear about these teams that they have their athletes bringing their own mattresses to where they're staying.
Mm-hmm.
I mean, there's such a priority placed on it, to those sleep hygiene things like you mentioned. And it just makes such a big difference. And I think, also to the point of sleep kind of getting pushed to the side for a lot of people, I think, one of the important things that I always want to have a balance of with these educational things that we're doing with the podcast too is I think people tend to fall on one side of the spectrum or the other of being like, oh, need to focus completely on quote unquote, natural things, or no, focus on like the medical interventions like medication and things. And the hope that I have for people is that I don't think any of these things are in and of themselves bad, but you do have to understand, like Dr. Tischler mentioned last week, there's some strings attached to everything you do. Mm-hmm. So, while it may, I think especially for people who like a concrete step to take, it may seem like a good option and it may be a good option for them, but to take, say, a medication or to take a stimulant to help them be more energetic through the day, understanding that every one of those things has another repercussion associated with it. So,
Absolutely.
if you're not getting good sleep quality and you're covering up all your symptoms of whether mental health or lack of energy or these other things, everything you throw in the pot has an equal and opposite reaction. So
Absolutely.
I think people understanding that's, if they understand that, then your goal is then not to not use those things, but to say, man, if I can fix my sleep, then I won't have to use as many of those things potentially.
Absolutely. At our fundamental core, we're biochemical machines, and you touched upon it perfectly. There's a cause and effect relationship with everything we do and everything we put in our body, whether it's putting in a bunch of water to hydrate. Our body's got to deal with that somehow. And the more, especially in that last episode that talking upon it, there are certain things that have more dangerous or more complicated effects than others. And recognizing that and maybe trying to cut back on those and incorporate the less risky, less taxing substances or dimensions of life into your day-to-day is an important component to training and just general health and well-being across the board. So yeah, I thought that was a very, very profound talk that was just given.
Absolutely. And kind of moving, kind of attached to that is, I think one of the biggest hangups that athletes have, and this kind of brings us to our next kind of topic or bullet point here, is from my experience, both as individually, my own experience, and then in working with athletes, whether it's been in my job or people that I've known, and all these, and even with some of the committees I serve on at the institution I work at, we talk about better stress management and anxiety for the athletic population. And I've heard some of the reluctance that athletes have had with pursuing different avenues for their mental health. And I think one of the things that's tough for very type A, concrete, I want to know what my workout plan is type people, is sometimes not having, when something feels very ambiguous, like they feel like, oh, like to them, if you just tell them to get better sleep, it's like, well, what does that mean? And so I think biofeedback or some sort of concrete thing, and we've even seen this, and this is something we're going to go into more in a future episode, but even biofeedback in counseling, of having people be able to see how some of the cognitive interventions affect them physically, I think those things are helpful to get buy-in from the athletic population. So like you mentioned earlier, as technology continues to progress, we see more and more advances in obviously the higher level technology that you use in, say, your laboratory, but also, inexpensive, more accessible wearable technology like Fitbits, Jawbones, Apple Watches, all that good stuff. That are now including sleep tracking in a lot of their means. Can you maybe speak to just the topic of wearable sleep technology and kind of maybe what some of the differences are between some of the kind of beefier stuff you use in your lab, and then in comparison, what is being tracked with things like a Fitbit or stuff like that?
Absolutely. So first and foremost, I think it's really important for people to take an interest in what's going on in their life, and biofeedback is a really fundamental aspect of understanding where you are and kind of evaluating yourself on a day-to-day, week-to-week basis. I think people can get a little too rigidly bound to numbers, and that can have a negative impact on life. But for the most part, I think anytime anyone's taking a general interest in their health and well-being, it's going to lead to a positive outcome down the road. And athletes specifically, I mean, I think in one of your recent episodes, you talked upon the idea of winning small battles or taking joy in small accomplishments as you go through these trainings. And the biofeedbacks provide a very immediate form of that. And that can be very useful to continue to motivate people through what can be 6 months to a year of training, and how that takes a rigorous toll on a mental state of mind. These devices currently, the ones that are most mass marketed, tend to utilize very similar technology to one another. Most are using what's known as a 3-axis accelerometer. So it's basically through that just measuring your movement. And that's how it's assessing steps or trying to determine activity counts, which then, based on its underlying algorithm, fits a lens per se to stage sleep or classify sleep into light, deep, things of that nature. The most recent development has been the incorporation of heart rate and utilizing heart rate variability and fluctuation throughout the night to assist movement trackers in their assessment of sleep. And we've seen an improvement in the ability to quantify sleep through this addition. With that said, most of these devices are limited. They tend to overestimate total sleep time, and thus sleep efficiency. And sleep efficiency is basically a clinical term for the amount of sleep time, total sleep time, divided by your time in bed. So how much time you've actually spent in bed actively trying to sleep times 100. So a percentage output after that. And it's basically just a general understanding of the quality of sleep based on the opportunity you've given yourself on a duration standpoint. And most of these devices, because of their overestimation of total sleep time, have an overestimation of sleep efficiency. Does that mean they don't have a purpose? Absolutely not. And what I've seen from my data and from what other people have published is generally about a half an hour on average of an overestimation of total sleep time. And that basically comes from the inability of these devices to accurately assess wake during sleep. Because the reality is, if you're laying there perfectly still, the device most likely will think that you're asleep. But you can absolutely be awake cognitively and be lay there very still. So it's just a limitation of the technology currently. In our laboratory, we certainly have sensors all over the body when we perform something called polysomnography, many, somno, sleep, graphic measurements. So various sensors throughout the body, coupled with the assessment of the electrical fluctuations in the brain, something known as electroencephalography, EEG, allows us a more robust, thorough understanding of what's occurring throughout the body and allows us to estimate and measure sleep at a much more thorough level and complete level. And until these devices are somehow able to incorporate electrical fluctuations in the assessment of that, and I have a couple theories of how that's going on, and there's some great work actually going on at MIT right now, utilizing some radio waves and things of that nature to try and track these. These devices will be limited in that capacity. But again, it doesn't undermine their utility. It just, these companies need to be transparent with their populations and letting them know what the capabilities and shortcomings of these devices truly are and what their purpose may be. One of the devices that's out there currently that I'm really fascinated with, and I haven't been able to directly work with, but I'm working towards hopefully building a relationship, is this WAMP device that alerts the individual and informs the individual of, and I'm air quoting right now, how restored their body is based on the sleep that they've been achieving over the last few nights or so, and thus how taxed the body truly is, and what sort of workouts or physical taxation they can really expose their body to, what it's prepared for. And I think that's an interesting component that a lot of these devices leave out, is this quantification of restoration. How well prepared is the body to handle a workout this morning based on what you achieved last night? And again, its assessment of sleep's a little bit limited currently based on our technology, but I think it's an important step to ultimately expanding these devices and making them more useful for the athletic realm. One of the really fascinating technological advancements that I'm really skeptical of, but also curious at the same time. Under Armour recently has made these pajamas that are supposed to help with cellular restoration during sleep due to some microfiber technology that absorbs certain wavelengths of energy and light. And it's supposed to work similar to, like, I don't know, maybe like a hot tub would work as far as like a soothing kind of aspect. And there's been some literature that's shown some positive subjective responses from these, but there needs to be just more objective evaluation of these mass marketed items before we truly understand what their capabilities and limitations are. And within that, one of my big kind of soapbox points is that I think consider, even with objectification that goes on in the empirical evaluation, that tends to occur in what we consider healthy populations within scientific realms, and younger healthy populations. And I think it's important to tailor our empirical evaluations towards disordered populations as well. As if we know that these devices respond differently based on the movement parameters of individuals, then people with Parkinson's per se, these devices may not be as reliable as someone who doesn't have Parkinson's, right? And so recognizing that and evaluating that specifically is of utmost importance going forward, so that we truly know whether these devices are useful and what their capabilities are within certain symptomologies.
Yeah, absolutely. I think it's a very good point, and I think a separate topic that is one of my big things that I kind of get going about, but I think we'll go into more in a separate episode, is helping people understand how to interpret research a little better. Because for things like that, anytime you have a very, as you know, and anybody that works in research knows, it's like anytime there's a mass marketed product and they point to the quote unquote like the science behind it, a lot of times there may be some good research behind it. There may be some research that has a lot of, as you know, a lot of times research provides more questions than it does answers.
Sure.
And so I think for people to understand, when they look at something that seems like, oh, this mass marketed product seems like the answer for me, understanding how to look at the research that backs it up and understand what the limitations are, like you said, is I think important for people, because so many things out there, so the marketing's good and they make it sound like, the science completely backs this up, and usually there's some limitations to that science, as obviously you spoke to.
Absolutely. And some groups perform methodology better than others, and some groups are funded by these commercialized industries, and that in itself skews the science and biases the science, as a lot of times those companies will have the final say in what actually gets published and the verbiage that's utilized. And certain data can be manipulated or framed in manners that may not truly convey what actually transpired, or how it actually the performance it demonstrated. And that's important to consider. And I'm not saying that every individual should get a PhD in statistics, but it's important to be able to tease apart literature, as you pointed out, to truly elucidate what transpired during that trial. And hopefully researchers are transparent in their dissemination of the results, and not just trying to quote unquote publish sexy findings that will get them into high-arching journals, as that is a limitation of our academic realm at this point as well.
Yeah, absolutely. And I think maybe to kind of summarize some of your thoughts on some of the wearable sleep technology, it seems, and this is, I love trying to utilize, even with the coaching that I do, biofeedback as much as possible. And that's one area that I think, even with looking at my own mental health care in the past and things like that, that I wish I would have utilized more of. But I think it's important for people, because of the things you mentioned, to understand that some of these things have a place, but you shouldn't be using them to diagnose anything.
Absolutely.
I think probably more of their value, at least to me, you could correct me if I'm wrong, is maybe taking, if you can compare changes from your baseline with that piece of technology, you can essentially detect trends, which can lead you in the right direction. But I think, not getting too hung up on exactly the quote unquote diagnosis of like your sleep quality is probably a good idea. And instead looking at, okay, according to what, say, the Fitbit said the first couple weeks versus now, am I getting better according to that baseline?
Absolutely. That's a perfect summary of the utility of these devices. And it's actually been a really important transition and paradigm shift for these companies. I won't say specific names, but a certain company went under some legal scrutiny recently due to kind of a fraudulent representation of what they were providing. They had a misrepresentation of sleep efficiency using the terminology, but presenting the actual output incorrectly. And that's fraudulent using a medical term inappropriately. And at the same time, they've done a great job to kind of amend how they present themselves. But it's important, as you pointed out, that these are not surrogates for replacements for polysomnography and in laboratory testing. These are important to continually monitor yourself longitudinally and then provide a lens into your day to day life, and can be absolutely useful when discussing sleep with, say, your primary care physician. But in no way should it be a replacement for our more comprehensive analyses. And if you do have any concerns about your sleep, it's important to follow up with a sleep specialist, as that is ultimately the only way that you will get the proper care and treatment that you need to perform optimally and sleep better.
Absolutely. And I think kind of the last point for the wearable technology piece, and it goes back to even something you mentioned earlier, is I think heart rate variability is a very underutilized tool in a lot of cases, both in athletics and I think it's getting used more now. But also, there's a lot of research looking at the effects of even different antidepressants people take and different things and how that affects HRV. And I think it could be a very useful tool for even somebody as they go in and say they're getting care from their doctor. They can have a little biofeedback to help them when they go back to the doctor to answer the question, how's everything going? And I think that's where a lot of these biofeedback areas, like you said, they can supplement what you're doing with a medical professional because when you go back in a month later, so whatever your medical intervention was, when they ask you how's everything going, rather than you going, I think it's better, you can be like, well, I've been, tracking some things and it looks like it's trending this way. And it just gives you better information to come to your doctor with. And the same thing from a coaching standpoint, there's a lot of people that use things like heart rate variability to determine their day-to-day training protocols. And from my standpoint, I think there's a place for that, but I actually like the idea of examining periods of time and looking for trends. So if you look at a semester-long football player at a university and you look at, here's a semester long of time, here's what their HRV trends versus their performance in the gym look like versus their performance on the field and in class, and then here's what their sleep look like, and then you sit down with all that data and you figure out what are changes we can make for next year. And I think that's where a lot of value in these things are, from my perspective.
Absolutely. And again, it's kind of being your own scientist and utilizing this information to tailor your nutrition, your exercise, everything within your life, so that one, you're happier, because that's the ultimate goal, and two, you're performing better. This is just another tool, another resource that's available to solidify proper technique.
Absolutely. So to kind of wrap up our conversation today, obviously, like we mentioned, we're kind of touching on it's kind of the broader scope of these, of what sleep is, ways that it's tracked, things like that. If somebody's listening to this and they know, like, I have a pretty good idea I'm not getting the right amount of sleep, whether it's because of my wakefulness in the morning or tiredness throughout the day, things like that, kind of little clues that have led them to believe they're not getting good enough sleep. What are some ways, and obviously every individual is going to have a different approach they may need to take, but what are some general ways that you think the average person, and particularly maybe an athlete, can work to improve their sleep quality?
Sure. Great question. And as you pointed out, a difficult one to universally summarize for each individual, as each individual is different. But Dr. Bootson, the late Dr. Bootson, the primary investigator that I came from at the University of Arizona, he was very influential in behavioral treatments for insomnia, and he pioneered something called stimulus control therapy, which has extreme relevance in our society that is overexposed to stimuli, electrical stimuli. Um, so the battle of proper sleep begins in the morning. It begins when you wake up, and making sure that what you do throughout the day, whether it's tailoring your caffeine intake or stopping your caffeine intake at appropriate time in the early afternoon, ideally at lunch per se, to not exposing yourself to too much light throughout the day. So I think specifically what people need to do, or easy things to implement, making sure that you are approaching sleep and the period of sleep in the most optimal manner. So that starts with turning off the main lights in your house, maybe an hour before bed. I'm not saying you need to turn off all the lights. I'm not saying you need to turn off your laptop or your TV, but starting to reduce the amount of artificial light that you're exposing yourself to. Another thing is building in a relaxation time where you disengage from the stressors of life. So having a meditation session. And I think our society is starting to embrace this a little bit more, that meditation doesn't always need to be sitting on a rug trying to levitate or something like that, or sitting in a group setting and getting whacked with a kendo stick or something like that and not moving. Basically, just allowing yourself to disengage from the day-to-day stressors, recognizing that the day is coming to an end, thinking about some things that happened today, good and bad, but then finding a cutoff point where you allow yourself to move on and getting ready to approach the next day. And that begins with good sleep. And so if you can cognitively prepare yourself, and the way I like to do it is kind of a stretching meditation. As I've been going through more and more rigorous training, as I'm stretching, I'll think to myself, like, you've earned this opportunity to sleep, and framing sleep in a very positive manner. A lot of times our societies feels an obligation to sleep rather than an opportunity to sleep. And those may be very subtle in the mind, but that can be very important to the actual quality you get. If you start thinking of sleep as this very important component to your general capability and performance and just general well-being, and looking at it as an opportunity, that in itself can improve sleep quality drastically. So I think those components of sleep hygiene, having a set regimen, as we talked about earlier, a schedule. For me, I like to wake up at 5 a.m. So I tend to get into bed around 9:15, 9:30, and I'm reading for a little bit of time until my body tells me that I'm ready to go to sleep. I don't just immediately jump into bed, shut off all the lights, and say, go to bed, as that doesn't work for me. So you need to build in time for your body to go through the processes necessary for sleep. And then you can also look to certain nutrition. Cherries have natural melatonin in them. Almonds have a good amount of magnesium, which will help with relaxation and help stimulate the processes of sleep. So there's certain nutritional things that people can do. Obviously, processed sugars aren't the greatest thing before bed. Cutting off exercise 2 to 3 hours before bed. Some people exercise within an hour before trying to sleep, and your body is not prepared to switch on and off from a very energized state to a non-energized state in that short frame of time. So recognizing that you are a bit of a machine, and there are components that can help the machine run properly. If you were a car and you're trying to get to a certain gear, you don't just shift up to that gear immediately or downshift all the way down to that bottom gear. You go through certain rungs, if you will, and that's similar to sleep. You need to downshift, if you will, to your lowest state through a comfortable manner rather than an abrupt manner. So giving yourself time for that. And again, this comes back to the prioritization of sleep and not thinking of it as this obligatory aspect of life where I'm going to work all the way through and then I have to sleep and then I can get back up and work again. It's this, I'm going to work, I'm going to enjoy myself, I'm going to build some time in for comfort and relaxation, and then I'm going to have this opportunity to restore myself so that I can have a phenomenal time the next day doing it all over again in whatever fashion I want to. And I think that's important. And one other thing that I see a lot, whether it's colleagues, friends, patients, if you will, I'm not a licensed practitioner, but the informal patient that I see in a day-to-day life, whether it's my Trader Joe's cashier, whatever it may be, but this cognitive framing of poor sleep. And I kind of mentioned it earlier, but a single night or an acute night of poor sleep, it isn't going to drastically affect your performance that much. And what you can do is actually, it's not a trick. It's a way to go through life of framing a poor night of sleep in a positive manner. So say you have a competition the next day and you're stressed out about it. And you're laying in bed and you just can't shut off. You just can't go to sleep. Well, the first thing you should do is get up and go in a different room, a low lit room, find a comfortable position, read, and kind of wait for your body to start triggering that you're ready to go to sleep again. The worst thing you can do is lay in bed and ruminate over the fact that your poor sleep quality is going to interfere with your performance the next day. That's just going to compound the issue. That goes into stimulus control therapy that Dr. Bootson pioneered. But the next day, if you still get poor sleep quality, framing that as like, all right, I didn't get the sleep that I was really looking for. That's okay. That means that I'm going to get amazing sleep the next night. And little things like that can actually go a long way for looking at sleep as a longitudinal rather than a short-term operation. Thinking of sleep over months rather than day to day will actually provide better sleep down the road. And I see that happen quite a bit with people where they get frustrated with themselves. They're like, why am I not sleeping well? I didn't sleep well last night. And that builds negative appropriations towards sleep, which ultimately will interfere with your ability to sleep going forward. So just give yourself the benefit of the doubt. Sometimes good sleep is just not going to happen. I mean, I'm well versed with sleep, and it's my vocation these days, and there are nights when I just don't get the sleep that I would desire. Does that mean I'm a bad person? No. Does that mean I'm not going to perform well the next day? No. But it does mean that I need to prioritize giving myself the opportunity for good sleep in the coming days, and also recognize that my body will respond and my homeostatic need for sleep will increase. So I will most likely have an easier time falling asleep and maintaining sleep in those days to come, and thus achieve the sleep that I'm trying to accomplish.
Absolutely. I think those are some very good points, and I think, essentially feed into what I would just like to encourage all the listeners, particularly those that are, athletes, towards is just, like you said, kind of remove the emotional view of sleep. I think we attach emotions to a lot of these things, and it can kind of cloud our ability to see clearly. And just, view it as if you were to write down all the aspects of your training program, and restorative methods is one of them. Sleep is one of those restorative methods, and you have to treat it like any of the other parts of your program. And I think if people can do that, they'll be less frustrated with, like you said, an individual bad night of sleep, or, they'll look at the big picture. So, and hopefully some of these things we discussed today will help with that. And in the future, potentially we could dive a little deeper into some of these things. But
yeah, and that's just real quick. That's a beautiful analogy. as some days of training aren't as productive as others. Whether you're a weightlifter, whether you're an endurance athlete, whether you're fielding ground balls at third base, sometimes you boot the baseball more times than you're comfortable doing. And sometimes in sleep, you quote unquote boot the baseball more times than you're desiring. And that night doesn't mean you're any worse of a sleeper. It just means that night didn't work out as you desired. And down the road, it won't have lasting implications. If it happens over and over and over and over and over again, then it's important to follow up with a specialized physician in some fashion to receive the appropriate treatment. But again, think of it as just another component of your training regime, and frame it as such.
Yeah, absolutely. I couldn't agree more. Thank you, Jesse, for going into all these things. I think you did a great job of touching on really a lot of different areas of what I know is a very complex and broad topic. And hopefully this helps people be able to kind of see a little bit under the surface of where they've currently looked at in terms of sleep. And like all these episodes, this is kind of a string to start pulling to go head down a little further in that direction. So thank you for going through all this today. It was some great information.
Oh, my pleasure, Joe. I felt like I was a bit scattered throughout the discussion as you addressed. There's a lot to cover, and we could spend the next 3 years discussing sleep on this podcast, and I'm totally for that, by the way. But I apologize if in any sense I was scattered, but I truly enjoyed it. So thank you very much for having me.
No, absolutely. And potentially maybe we can do another conversation in the future and dive a little more into one of those specific areas. But no, I think it was great information. So thank you.
Excellent.